Hey there, I'm Lauren Lowry in the WSMV4 Now streaming studio. There has been a very big vote on a very big story that we've been following for a couple of weeks now, specifically as it deals with the hepatitis B vaccine that has been typically given to children right at the point of birth. Right now you're looking at video of the CDC panel. Let me see if I can pull it up for you full here in just a moment, see if it'll autoplay. Here we go. Okay, so the vaccine is given within the first 24 hours of life. When a baby is born, that's when it's given. And for the last 34 years, that's been the case since 1991. Fast forward to today, we've seen a 99% drop in hepatitis B infections in children, acute infections, that is. Let me pull this up for you just so you know what we're talking about with hepatitis B. It's a virus causing an infection of the liver. It's a permanent chronic infection for children, and it's passed through blood, semen, razors. I mean, literally anything. Like if you come in contact with a bodily fluid of an infected person, you then get hepatitis B. And again, it's this virus that infects the liver. If an adult gets an infection, it is not necessarily permanent, but if a child gets it, the research is showing that it is pretty permanent, pretty chronic. And the vaccine, when it was enacted in the early 90s, it prevented 6 million infections and even 1 million hospitalizations. That's what the idea is with this. So we're talking about quite a big thing. Now, the vote today that you see on the bottom of your screen, the words I've put up for you, this is about a vaccine rollback. So today, the CDC, the Vax Advisory Panel, voted on a rollback of this vaccine. And that Hep B vaccine currently is given, again, within 24 hours of birth. And this group today voted to wait at least 2 months for the first dose. 2 months, meaning a baby, instead of it being 24 hours old, the baby would be 2 months or older. 3 of the 8 members on that panel voted against the change, and then now the CDC director is going to need to decide whether to adopt this or not. So this, of course, is a big story, right? This is something that a lot of people are interested in. Let me play for you a story that one of our media partners put together just in the last few hours here.
We absolutely have not reached consensus.
You have said we have reached consensus.
A chaotic meeting.
We absolutely have not reached consensus.
You have said we have reached consensus.
A chaotic meeting Thursday among members of the Vaccine Advisory Panel for the Centers for Disease Control and Prevention. The meeting centered around the hepatitis B vaccine, whether it should be given to newborn babies, even if the mother tests negative or their status is unknown.
And there's broad agreement that hepatitis B is a serious health threat with serious outcomes. That's not up for debate.
What was up for debate was if additional data is needed on whether the vaccine should be delayed and the dose. The Vaccine Advisory Panel is made up of members handpicked by U.S. Health and Human Services Secretary Robert F. Kennedy Jr., a longtime anti-vaccine activist.
You know that the decisions that they're going to be making are not science-based.
Vaccinating all newborns against hepatitis B was first recommended in 1991. Since then, hepatitis infections among infants and children have dropped 99%, from an estimated 16,000 to less than 20, according to the American Academy of Pediatrics. A recent article from the AAP states while universal screening of pregnant people is helpful, it does not identify all infected mothers. They went on to write, evidence shows the vaccine is safe. But some worry this latest debate will create further confusion.
It has already sowed unneeded anxiety, confusion, questioning, and concerns in American families who are trying to make the best decision for their children.
I'm Jen Sullivan reporting.
Again, that was a story from our media partners putting that together that aired early this morning before this vote was taken. The vote has now been taken, and they are voting. The panel, the advisory panel specifically, is voting to roll back these recommendations that would require a medical provider to provide that vaccine in the first 24 hours of life for infants. And the change would be to delay it by at least 2 months. So you're looking here at video from this morning from that panel meeting. I want to play for you something that was said in this meeting today.
And I will just say, we've heard do no harm is a moral imperative, we are doing harm by changing this wording. And I vote no.
I agree with Dr. Meisner that this has a great potential to cause harm, and I simply hope that the committee will accept its responsibility when this harm is caused, and I vote no.
Okay, so right there were 2 of the people who voted no. 3 total of the 8 members voted no on this. But again, this advisory panel has voted to roll back the recommendations. Currently, that hepatitis B vaccine is given within the first 24 hours. But this group has now voted to wait at least 2 months for the first dose. And now it goes to the CDC director to decide whether to adopt this vote. I mean, that's really what this comes down to, is whether this vote will be adopted at this point. So there have been instances where there's instances in research that have shown no difference between administering that vaccine as soon as a child is born versus waiting a few months. And if there's no statistical evidence, you could presume that that's what they're making the decision off of. But the concern is still what I was showing you just a moment ago, which is a significant number of infections, a 99% drop in Hep B infections among children from 1990 to 2019, and an estimated prevention of 6 million infections. So again, this is a virus that infects the liver. If it's an adult, it is an acute condition. If it happens to a child, it's deemed chronic. So we're going to keep watching this story for you. Certainly, we're going to learn from the CDC director at some point what's happening with this, and we will pass it along to you if it's passed on as the new CDC guideline.